Friends, it's a practical application of alignment, your understanding of anatomy, physiology, biomechanics and yoga. I'll just show you a demonstration of a small simple an image. So there is just a human body, it's a head, neck, back, thighs, leg and ankle. So I say that neck area, back area, your knee and heel. So heels are nearest to the earth. So usually 90% of the time you do not have heel pain unless there is a calcaneal spur or fracture or injury or anything like osteoporosis or something. Usually you do not have heel pain. Knee pain also, unless there is a osteoarthritis or there is a rheumatoid arthritis or knee injuries, you do not have knee pain because knee joint is a strong joint. The neck pain, usually neck weighs about 10 kg of weight, including brain, skull, all the facial features, neck muscles, everything. The weight will be around 10 kg of weight will be on the neck. Usually neck pain also less. So more common pains are related to back pain because the alignment of spine is different. It is curvature is different, and if I say this as a center of gravity divides your body into two halves, passes through external auditory meatus, your acromion process, your anterior superior iliac spine, 1/3 of the knee, 1/3 of ankle and 2/3 of the 2/3 of ankle and 1/3 of the ankle. If an imaginary line is drawn from ear hole, shoulder blade, acromion, side of your pelvis, lateral part of your knee and 1/3 of ankle and 2/3 of ankle, that line exactly divides your body into two halves. If somebody is having shoulder pain, it means that there is a pressure on this area and the alignment is lost. If somebody is having big belly, there is a much of lordosis happening. Because of this lordosis, the pain of back is more. So what I mean to say is, if we can work on the alignment of the spine and alignment of your feet, base of the big toe, base of the little toe, base of the heel, base of the little toe, base of the big toe, base of the heel. If I make an imaginary triangle, if I can put my body position into that, visualize the base of the big toe, base of the little toe and base of the heel, and put your body weight aligned to those 6 points and bear your body weight in that alignment. And from the sides, if you can align the ear, shoulder, hip, 1/3 of the knee, 1/3 of ankle and 2/3 of ankle, you are going to achieve a perfect balance of standing posture where your balance is much better and the pains and aches because of change in the alignment, because of change in the center of gravity can be much reduced. So this is a knowledge of biomechanics, this is a knowledge of the anatomy, physiology of your body. If you know it, you can apply much better. For example, somebody with the with the shoulder pain, I can suggest Bhujangasana with the elbow support or with the normal hand support. There is extension of spine. Extension of spine, there is a relief of back pain. If I suggest downward dog pose, the shoulder joint, the hip joint are working extensively and there is an extension of elbow and the knee. So extension at the level of elbow and the knee and gentle flexion at the level of shoulder and the hip joint. So when you correlate the anatomical correlation, when I am studying muscular system or skeletal system, you know the skeleton, what skeleton it is a pelvis board. Pelvis with the ball and socket joint, it is here. There is a much of flexion achieved at the level of shoulders and hip joint, and there is an extension of elbow and the knee joint in the downward dog pose or Adho Mukha Svanasana. If somebody is having shoulder pain, if somebody is having ankle pain or heel pain or the hamstring pain or something pain at the level of leg, I usually do not advise it, or I use a posture where there is a much of relaxation rather than the stretch. So similarly, you can decide upon what kind of asanas you can choose for what diseases. Like downward dog, I don't use in hypertension. Too much of hypertension patients I don't use. I don't use downward dog pose if there is an eye issue. Increased intraocular pressure of the eyes, I don't use downward dog pose. So this knowledge is important and it is very subtle and it is very key element for you to decide are you a good yoga teacher or not good yoga teacher. With this introduction, I suggest you go through details of studies with us in anatomy and physiology and study well, be a good yoga teacher and be a good yoga therapist. Thank you.